Now, recently at the American Heart Association meeting in Chicago a couple of weeks ago, the results of the trial REDUCE-IT have been published, raising a lot of debate and interest. This is a trial where they selected patients to be at secondary prevention, 75% of them, or having diabetes and at least one risk factors, with a triglyceride level at the entry between 150 and 500 milligram per deciliter and an LDL cholesterol between 40 and 100 milligram per deciliter in the background of a moderate to high intensity statin therapy. The pharmacological approach was to use 4 grams a day of purified EPA, which is an omega-3. 4 grams a day in these patients. Follow-up is 4.9 years. Results are extremely positive. It's about 25% reduction in the primary endpoint, which is cardiovascular death, non-fatal MI, non-fatal stroke, and hospitalization for revascularizations, and a 26% reduction in what I consider a harder endpoint, which is cardiovascular death, non-fatal MI, and non-fatal stroke. The benefits seen in REDUCE-IT are only partly due to triglyceride reduction, because in fact, patients receiving 4 grams a day of EPA as compared to placebo had only a 20% reduction in triglyceride, about 45 milligram per deciliter, which is below what we expect by the use of omega-3, usually in the range of 35 to 45, 50% reduction. Of course, we know the omega-3 have other effects, could be anti-inflammatory effect from the literature or anti-aggregants effect. For example, there was a slightly increased but not significant bleeding as a side effect in those receiving omega-3, and particularly EPA in the REDUCE-IT, accounting for the anti-aggregant effects. CRP decreased in a significant amount by about 40-45%. That might have contributed to the beneficial effect, which once again, it's clinically extremely relevant because it's 25 to 26%, whether you look at primary or secondary endpoint. Now, if you put that results side by side with some of the major trials recently published, for example, trials on PCSK9 inhibitors, where the results and the benefits range from 15 to 20% according to the primary or secondary endpoint that you consider. And if you look at the differences in the costs of the omega-3 EPA used in REDUCE-IT as compared, for example, to the PCSK9 inhibitors, makes these results extremely interesting.